A central line has 1 to 3 lumens attached, and each has an injection cap, a small plastic piece that is screwed onto the end of the catheter. This cap prevents blood from backing up into the catheter, and it prevents leaking or allowing air or bacteria into the bloodstream. The cap is changed every 7 days when the dressing change is done. Gather supplies: cap, alcohol pad, clean gloves, and mask. One for the person with the central line, and one for the person changing the cap. Clean your hands with antibacterial soap or an alcohol-based hand sanitizer. First, put on the face mask, and then clean gloves. The person with the central line should also wear a mask during this process. Carefully peel the cap package open and leave the cap inside. Place the packaging on the surface. Make sure the catheter is clamped. Unscrew the old cap. Scrub the end of the catheter with an alcohol pad for 15 seconds and let dry for 15 seconds. Be careful not to let the end of the catheter touch anything other than the alcohol pad. If it does, then repeat the scrubbing and drying process. Remove the protective tip from the new cap. Make sure the open end of the cap does not touch anything except the catheter. Screw the new cap on the catheter and make sure it is on tight. Repeat the steps for each additional lumen. Call your healthcare provider immediately for any of the following: fever of 100.4 or greater, or chills, swelling of the face, neck, or arm, drainage, redness, swelling, severe pain or bleeding at the exit site, difficulty flushing the catheter falls out all of the way or part of the way, damage to the catheter such as a leak, hole, or crack. Important safety tips: always wash your hands before touching your catheter. Never use scissors near your catheter. Carry an extra sterile cap and alcohol pads with you in case the cap falls off. Use tape and plastic covering over the clear dressing before showering, and remove plastic covering after showering. Call the home health nurse if the dressing becomes wet, loose, or soiled. If no nurse is available, change the dressing if you have been trained. Do not change your own PICC dressing, because the PICC dressing is not sutured. Always clamp the catheter when not in use. Plan ahead so you do not run out of supplies. We hope that this information will assist you in caring for your central line. This can be a difficult time in your life, and we want to be there to help. Please contact your healthcare team with any questions.